Hi, well, it's the 31st of January 2012, just seeing Dr. Roger Oldham, one of the men really why I'm able to row the Atlantic this year. He's straightened my back from in the last year, and he's supported it with Prolotherapy. So you'll see a few clips of actually what Dr. Roger Oldham has done, and combined with Ian Andrews, our physiotherapist. Really, I was heading to a pretty bad place about a year ago, but really now it's stable and solid. So this is Leicester, England, and I think it's about to snow. Anyway, we'll give some footage of Dr. Roger Oldham, the only guy in the world pretty much injecting Prolotherapy without any radiology, which means that he's actually doing it by feel and by touch. So he's an incredible guy. He's fixed hundreds of Premier Division football players, and one of probably the best guy in the world for Prolotherapy. So there we go. All right, watch and enjoy. Thanks.
Right. So what we're doing now is we're just strengthening the ligaments between the spines, which are called the supraspinous and interspinous ligaments, to improve your core strength. So the ligaments will be supporting your back rather than relying solely on your muscles. And the blue mixture is a mixture of dextrose, sugar, glycerol and a small amount of phenol, which are chemical irritants. So they will inflame the ligaments in a controlled way and promote healing. They stop growing at the age of 20 when your skeleton stops growing, and then if you do sport or have certain injuries and the ligaments are stretched, because they don't have a blood supply, the healing is very poor. And by inflaming them in this controlled way, blood vessels will grow into the ligament, and so the ligament will heal at approximately the same rate as muscle. So we can get a ligament to heal itself in 2 or 3 weeks, as opposed to 2 or 3 months by using chemical irritants, which is drug-free treatment, and your body's doing the healing. We know, for example, that if you strain a ligament on the inside of a knee, if it's left to heal in the normal way, after a year you're left with only 50 to 70% of the tensile strength of the ligament. So you're then vulnerable to further injury. So it's important if you're in sports or just everyday life, if you have a ligament becoming lax, Prolotherapy is the only way of getting the ligament to strengthen back to normal. And each injection is additive, and in most cases 3 injections will restore normal ligament strength.
It's certainly working for me anyway. So.
Well, the other advantage is obviously, apart from being drug-free, it doesn't mask any symptoms, so there's nothing producing pain relief. And if your back feels stronger and less painful, it's because it is, because it's stronger.